Hi, and welcome to the Dr. Shelley Meyer YouTube channel and the Women in Medicine Be the Change podcast. I'm here with Dr. Tamara Beckford today, and we are going to talk so much about self-care. I'm so excited about what she's doing for docs with self-care. But first, Dr. Tamara, I want to hear from you, your individual background, I know there were some certain things with the pandemic that led you to where you are now. And just, it's really unique, your story. So if you could start with your background and how you got where you are now, we'll go from there.
Oh, wonderful. So welcome. Hello, everyone to your wonderful channel. I'm Dr. Tamara Beckford, and I am an emergency medicine physician. I'm in Houston, Texas, and I'm originally from Jamaica, living in New Jersey, went to medical school in New Jersey, did my training in Philadelphia, and then decided to go down south to Texas. So I've been here in Houston for many, many years, been working as an ER doc, and we know that, it's a stressful life, period. One of the things that augmented all of this stress, of course, is the pandemic. So throughout the pandemic, one of the really ironic changes that I noticed had occurred in my life is that instead of me being more stressed, I actually got calmer and more relaxed. And I started to wonder, why is it that I'm feeling this way, especially when I look around and I see my colleagues stress levels and anxiety levels have gone really high. And I started to look at the difference in what I was doing and difference in what some of my colleagues were doing and the way that I approached what was going on in life at that time. I wouldn't even say that time because we're still in the pandemic, but it's just not as crazy as it was 2 years ago.
Especially being an ER doctor, my goodness. Yeah.
Absolutely. With so many waves. So what I noticed is that I started to implement certain little elements into my lifestyle. And those elements really brought a sense of calm, it made me find more of a sense of purpose. And it made me really determine my own destiny on how I was approaching my life overall, as opposed to really just sitting back and being bombarded by everything that was going on and just reacting to it, having the continuous level of stress, no matter what. So even though I was fearful, I have 2 young kids. I'm a mom. When the pandemic started, my son, my youngest was 1.5 years. The other was 3. So, I did worry, what am I going to do? How, we don't know what this thing is. Can I bring it home to my family? I did put certain things in place to try to ensure that I did my best for my family. But as the time went on, I kind of got calmer. And that's what I realized was my self-care routine. And I said, wow, this is pretty powerful. Because I said, if this is going on with an ER doc in the middle of a pandemic, I said,
you can stay calm.
Absolutely. I said, these small but powerful techniques should be able to help others, in the midst of what they're going through. And they're just really very small elements that put together steps that keeps you in a frame of mind of staying forward and not just, and being mindfulness also, and being mindful of where you are right now, enjoying the moment, and just really powerful techniques. And that's when I said, okay, I have to tell everybody else about this. I can't just keep this to myself. Absolutely. So this is when I forged onto this self-care plan and really trying to implement it and showing others how to do so.
Great. And before we forge away into what you're doing, which is really interesting, let's talk a little bit about you observing other docs and seeing what's going on. As, we're focusing on women in medicine here. Why do you think a lot of us are staying in these places of feeling stuck or feeling overwhelmed and not being, I know the system is a bit broken. We can't blame ourselves for this, but having good self-care and good mindfulness techniques can really help us get out of it. But why are we kind of in this situation in the first place?
I think that there are a lot of reasons why we're in the situation in the first place. If we really just look at traditionally our roles in a lot of everyday life, right? As I mentioned, I'm a mom. I'm also a wife. I'm also a daughter, and I'm the eldest of the children. And, so you see all the roles that just me mentioning this for all those who are watching, who are women, I'm pretty sure emotionally you felt everything. Like when I said I'm a mom, you felt, oh yeah, me too. And I'm a wife, oh yeah, me too. And, I'm a parent, I'm a child, I'm the eldest, me too, because all of those contain different roles. And immediately you visualized, I also have to do that. And in addition to that, I have a career and I'm working full time. And that also said, oh yeah, I figure, yep, I understand what you're going through. So with either of these roles, even when we're at work, we have the roles when we're at work in leadership. And I mean, even if you're not traditionally in the C-suite, as a physician, or someone in medicine, you're in a leadership role, because what does the community, who are they looking for guidance when it comes to things related to health? Yes. If you've gone to a cocktail party and the person so happened to find out that you're in medicine, everyone's asking you, it hurts when I do this. What does that mean? So there are just so many roles and you're being pulled in many directions. And sometimes it can be all at the same time. So that can lead to additional burnout, not even just career burnout, but just burnout overall, fatigue, mental fatigue, physical fatigue. And we're not even talking about even societal's expectations for women, for physical appearance, for, what you should be able to do. And then as women, when we even think about our roles, trying to balance career and parenting, right? There's something that changes in our mind when we become a parent. I mean, if you even look at the careers, the career choices and the mindset of women from when we were in high school, college, and then when we actually approached our careers. I mean, a lot of women, when they're in high school, I'm going to conquer the world. And you really have this, gung-ho drive to do that. Then when you get into college, you're still like that. Then once you starting a family, then you're balanced and you realize like, wow, I want to do all of this, but I now have to make this choice. I'm raising the younger generation. How do I do both? And a lot of times we make the choice to raise the generation, which is an admirable choice, because we start to suppress our own career choices in order to do that. So, I mean, it's so multifactorial. I mean, there's a lot of pressure on us women from many different stages in our lives. And then even thinking about, you've decided to take some time away when you try to go back into your career. You thought, am I obsolete? Will I be respected again? Am I considered a thought leader, or am I considered a has-been? It just goes on and on and on. And it's a factor that it happens to so many of us, and so these all contribute, they all contribute to just how we feel and all the different emotions that us women have to deal with through our lives.
Yeah. Yes. Well, tell us your secrets, or just how important self-care is, because we're not going to, we want to be the change and make some changes, but we can't overnight change the system, obviously. But we can change how we respond to
absolutely.
And self-care is a big piece of that, having the mindfulness, having just being in connection with ourselves, right? So talk about how you do that for yourself, and then we'll talk about your community too, but, and any kind of tips you want to share.
Absolutely. And, one of the biggest aspect of self-care, as we mentioned, is awareness. For me, my self-care is a little bit every day. little bit every day. And I start up with a great wake up routine. Some people consider it a morning routine, but because I work overnight, my morning is at 4 p.m. before I get up to go and pick the boys up from school, right? Or daycare, because that's the only reason why you can do 4 p.m. because they're in daycare. And however, my mindset is that I have to build my mind up daily. I have to infuse it with things that are powerful and will keep me grounded and will keep me centered throughout my day. And I do that from the onset. So for me, once I wake up, I'm a spiritual person. So I'm reading my Bible. And that's, first thing that's going on. Before I even do that, I don't have my phone on my bed. My phone is across the room. Right. Once the alarm goes off, get up and walk across the room, turn it off, and start my day. That's something that I developed during this time. I was a snooze queen. I would hit that snooze button when it's right there and snooze, 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 until I realized the impact of how sleep affects the body. And going back into the sleep cycle with the snoozing was more detrimental to me than really thinking that 5 minutes was helping. No, it's not.
Yes. It's not helping anything. You're awake anyway.
You're awake. Exactly. Your body's going back into its 90-minute cycle and you're only giving it 5. Right. It is upset. So next, I really, as I mentioned, I read the Bible. And then after that, I'm reading something for at least 20 minutes. I have a book that I'm reading during that time. And I do 20 minutes of that. And then I'll start getting ready for my day. So all in all, that's just 25 minutes in the morning. And then once I'm getting ready, showering, I can listen to any podcasts that are also there that's, positive, that's informative, that's improving my life, the way I look at things, my learning how to change behaviors that are not beneficial to me at this time, such as even what I just mentioned, the snooze button. That's something I learned from the podcast. And I said, oh, wow. Okay, well, maybe I should try this. And now it's been like 2 years. And I mean, for the other 30 something years of my life, I was snoozing. And now I'm, you're implementing these techniques, but they're small, but they're so powerful, right? They're so powerful. Gratitude practices, recognizing that when your mind wants to take you into a dark realm, when your mind wants to take you into a state of self-pity, when you pull yourself back and said, wow, I'm grateful for, and you list them, your mood changes, your attitude changes. When you do these small practices and then you enter into your day, they're entering into your day from a far different perspective. Any negative things that could come towards you, an email that's there from a boss, or for us in healthcare, the infamous, this patient complaint when you did your best, all of that emotionally hits us hard. But when you have prepared your mind, you're now more responsive versus reactive to that.
Yes. Now, there's nothing. That's a big point.
Absolutely.
Responsive versus reactive. Yes.
Absolutely. And so these are just small techniques. And I said that we can all do. We can all do these things, and they're powerful. And then they can get us through. They can get us through the day, and they get us through your response to any negative things that happen. Now, it's not to say that now you're invincible. No, you're not. And like we said, there's still systemic issues that's going on that causes multifactorial issues, that causes burnout. But what we can try to do within ourselves is just as important for us in order to deal with these changes that we know will take a longer time to occur systemically, right? So that's
because there is no perfect job in medicine. I mean, we love it for a lot of different reasons. We all have our different reasons we went into it and our specialty choices and everything. But even I have my own practice that, nobody's telling me what to do. Nobody's giving me a chart pressure or anything like that. But there's the patients are my boss, basically.
Absolutely,
and,
yes.
so there's not pressure of I need help and I need it now, or you didn't fix me or something like that. Not that
or
most
the
of my
social
patients aren't like that,
media.
but
Well, no,
just that
well,
pressure
we
is
hope
always
not.
there. What'd you
Absolutely.
say?
Yeah, no, I said,
Yeah.
or the attack via social media,
Right.
and these are things that someone might not recognize how powerful that attack. You're upset because of a said interaction, or you were not able to get your way. And then you take it to social media and attack that physician. Like, you don't recognize, like, you might think like, oh, I just vented and got it out. But that right there is such a powerful disruptor to that physician, to their space overall, their mental, their physical space. Mind you, it might even cause career issues. Like, there are just so many factors that are out there that are beyond our control, but we can try to control ourselves, and we said our response to those situations.
Right. That's what we can control, our thoughts and our response and how we react to those thoughts, and be responsive versus reactive. I think that's very important.
Absolutely.
Tell us a little bit about the community you're building and the way you're spreading your message.
Okay. So the community I'm building, it's a society. It's called the Your Caring Society. So I'm spreading the message far and wide via social media. So within the community, the premise of it is that we, as busy professional women, we have to put ourselves first, and we have to do so without guilt.
Yes.
And we have to do so because, as I mentioned at the beginning of this conversation, we have so many roles. And within those roles, putting ourselves first was never considered an option within those roles. Traditionally, once you became a blank, you no longer worried about yourself, right? And even at times when I ask on social media, I'll ask questions, say that, what are some of the things that you would do for yourself? Do you consider that? And like, well, once I have a child, my child is now first, and I will do anything for the child. And I recognize and I respect that. But I also believe that you being there is more important for your child. So with you being there, we're talking about as a whole, mentally, physically. When you're mentally exhausted and you're physically exhausted, you're unable to give your best to that child. And so when you can restore just a semblance of that through self-care, then you're able to now have that balance with you and your family. And I've noticed that I had to, at times as busy moms, we might not have that perfect time during the day. It might require us waking up a little bit early to get that time, or it might require us having to, after everyone goes to bed, to just take that 30 minutes to ourselves. Some people love the bubble bath. Some people love to read, something that just relaxes the mind. But it's important. It's important. It doesn't necessarily have to be the big vacation that you're going on. Because some people are like, well, my vacation is self-care. Really? Let's think about that.
No, it's not.
You have to come back. You have to come back. Plus, you have to plan it. And who wants to plan when you're burnt out, when your brain is fried? So when you can just really do that in small steps, and then you'll make that a big, an additional step, but that's not your first step. Each day, dedicating a little bit of time to yourself, that's your self-care.
I totally agree. So the name of your community is You Are Caring, and how can people find it? I'm sure you're on different social media platforms. And
absolutely. So people can find me, Dr. Tamara Beckford. I'm very, very, very pronounced on LinkedIn right now. So if you want to come on LinkedIn, you can just look for my name, Tamara Beckford. That's TamaraBeckford. So Dr. Tamara Beckford, and you'll find me there. And all other social media platforms, I'm there as Your Caring Docs. That's URCaringDocs. And I have a lovely website at yourcaringdocs.com. That's URCaringDocs.com.
Great. because I really want people, it's such a good message you're spreading. So definitely check it out. And I'll put it in the show notes, of course, for the podcast and the description. So everybody has the link. It's been such a great conversation. I really appreciate you sharing this message. It's so needed for women in medicine, for professional women, all kinds of women, because we have all these pressures and there's so many societal, business, cultural, all these things that we are taking on. So, taking better care of ourselves should be our number one priority. So
absolutely.
Great information. Thanks so much for being here today.
Thank you for having me.